Hello, I'm Dr. Mark Richards, a medical doctor, here to talk with you today about my book, Nobody Wants You Healthy. More about the book can be found on the website, nobodywantsyouhealthy.com. The first section of the book is called Profitable Perversity, and it outlines how the profit motive has undermined your ability and the public's ability to be treated in a way that would cure and prevent chronic diseases, because chronic diseases are the source of the vast majority of income. Chapter 1, Dawn of Understanding. This relates my personal story of how in Paris in 2005, something clicked, and I all of a sudden started to question what I had been taught, why I had been taught it, and what was underlying this epidemic of chronic diseases that was spreading through the US, Europe, and most of the developed world. Chapter 2, the health bomb. We're talking about endocrine disrupting chemicals commonly found in plastics and how they have destroyed much animal life on the planet, including humans. Chapter 3, the most abundant hormone. This chapter focuses on the hormone that is most abundant in males and females, and as a matter of fact, much animal life, and how endocrine disrupting chemicals, by disrupting hormones, affects this hormone greatly. And that hormone is testosterone. Chapter 4, how testosterone prevents diseases. This chapter, like all the chapters in my book, is fully referenced by the best peer-reviewed science articles I could find on the subject to document that everything I'm telling you is true. Chapter 5, diabetes and its reversal by testosterone. Here's a little-known fact, especially among the doctors that are treating diabetes. But low testosterone greatly increases your risk of developing diabetes, and testosterone therapy decreases the severity of the disease and in some cases reverses diabetes. Chapter 6, female testosterone deficiency. Yes, the most abundant hormone in all female humans is testosterone. And when it's deficient, they develop a disease complex that we call menopause. That's right. Menopause is a deficiency of testosterone because it turns out that testosterone is the source of over 98% of all the estrogen inside our cells, whether you're male or female. Chapter 7, male testosterone deficiency. So while we associate menopause and menopause symptoms with females, the exact same symptoms happen in males. And that deficiency causes all sorts of disease processes that we're going to get into later in the book. Chapter 8, breast cancer reduction with testosterone. Yes, this is a shocker. This one still infuriates me. 2 10-year studies of treating women premenopausal and postmenopausal with testosterone therapy validated a nearly 50% reduction in the risk of breast cancer. And yet, no public health establishment has even discussed this. Chapter 9, prostate cancer regression with testosterone therapy. Now, this is a shock to most of us doctors because we learned in medical school that testosterone causes prostate cancer and makes it grow. In fact, the opposite is true, and we discuss it in this chapter. Chapter 10, testosterone maintains a healthy cardiovascular system. Well, just recently, the FDA took cardiovascular warning off of testosterone therapy. It never should have been there in the first place. Many decades of research have shown that testosterone therapy in hypogonadal men reduces heart risk and stroke risk by over 50%. Additionally, it shows that in heart failure patients, male or female, treating them with testosterone greatly improves their cardiac function and their quality of life. Chapter 11, testosterone improves mood. Yes, we've all heard the rumors of roid rage and attributed it to testosterone, but actually testosterone, when they studied it, turned out to be the friendly hormone. It decreased aggression, it decreased anger, it decreased irritability, it decreased anxiety, and it greatly decreased depression. It turns out that the estrogen receptor binding aspects of those synthetic hormones that are not testosterone are what cause roid rage. Chapter 12, Testosterone and bone health. Yes, because testosterone is responsible for almost all the estrogen inside of cells, testosterone helps prevent osteoporosis and osteopenia, because bone cells need estrogen in order to grow bone. And when your testosterone is deficient, your bone cell estrogen is deficient, and your bones get weaker. Chapter 13, building muscle, reducing fat, and preventing sarcopenia and obesity. Testosterone is key in these functions, not only through inflammation, not only through sugar metabolism, but through the growth aspects of bone, muscle, and the use of fat as an energy source. Sarcopenia is a disease of aging. It's called the wasting disease of aging. It makes you frail. When you fall, you break things and die. Testosterone therapy seems to be very powerful in preventing it, in addition to reducing the risk of heart attacks and strokes, and Alzheimer's and dementia through its anti-inflammatory properties in the brain. Chapter 14. No book would be complete without talking about sexual function restoration and testosterone. The pathways of sexual function restoration run the gamut of your entire body, from a healthy mind, a healthy mood, to healthy tissues, to a healthy heart, and to the increase in nitric oxide production in your erectile tissues. Yes, and even the estrogen production in men and women allows those sexual tissues to be healthier and withstand the normal traumas of sexual intercourse. Chapter 15. Why my patients who receive testosterone therapy, of which about 55% are female and 45% are male, only receive testosterone pellets. In brief, they only receive testosterone pellets because it is the only therapy, and it's been used since 1940 in this country. It is the only therapy that provides steady state availability of optimal levels of testosterone to the tissues for months at a time. Typically, women get inserted with a testosterone pellet every 3 months, and men get their pellets every 4 months. There is no available testosterone product that provides steady state levels for months at a time. When you have levels that fluctuate wildly up and down and do not reliably provide even therapeutic blood levels, then there's a problem with your therapy and your cells cannot respond optimally to the treatment. Chapter 16, the reasons nobody wants you healthy. So this chapter is really for people that want to look at health policy and understand the perverse incentives that are present in our political process and in our insurance and pharmaceutical industries that make them actually happier when there's chronic disease because their bottom lines improve. And when their bottom lines improve, then they can spend more money on advertising, which helps the media itself because sometimes 60% of their advertising dollars come from corporations such as the insurance industry or the pharmaceutical industry. The pharmaceutical industry is the largest funder of political campaigns. It's a very incestuous system that the public needs to be aware of so that they can judge the truthfulness of the people that are trying to keep them sick. Finally, we get to the appendices, and normally the appendices don't have too much to offer, but in this case, there is a MRS scale, which is the menopausal rating scale for women, and the AMS scale, which is the andropausal rating scale for men. And it's just a series of questions, but these questions have been carefully selected by the Zeig Berlin Institute, which created it over years and tested it across 32 countries. It is a very good indicator of testosterone sufficiency in somebody's tissues. Probably it is more accurate as far as testosterone adequacy than even a blood level, because a blood level only measures what's circulating around in your system. It does not measure what's inside each cell. And that is where the function happens.